I'm Tony DeFrancesco of Cisco. What I'm trying to do today is talk about mobility in healthcare and how really technology can help you with the information environment. So as you see here, the title is Connecting Clinicians, Patients, and Information. I really want to talk about information, not technology. I'm not a technologist by trade. I really come from a healthcare background. One of my colleagues, Doug Metz, is here also, a healthcare, part of the healthcare team. We have a rather large team at Cisco. We have doctors and nurse practitioners and folks like myself who come from the imaging space. So try to just interact. If there's any questions, concerns, or anything, just feel free to stop me. I'd be happy to go back on the point. So let me start out with some affiliations. And there's been people here that spoke before me in the last previous sessions that have been involved with Chime and AHA and HIM. And we're in the same thought leadership role. We want to make sure we educate the customer on what's important to you in terms of trends in the marketplace. So we try to keep up to date with those activities, make sure that we're retrofitting or creating solutions that make your life easier, basically, from a patient standpoint and from a quality standpoint. So if we look at how we define, sometimes we just step back from it. Hospitals are really the mainstay, but there's a lot of associated parts of it as an environment in healthcare, as you all know. So you've got all these different entities that have an interest or stakeholder within the healthcare environment. What we're trying to do is make sure we can communicate effectively with all these folks, either as a patient, as a clinician, a physician, or maybe a payer or a lab or the government, and so forth and so on. So you've got this extended community of healthcare. That's more than just hospitals and doctors and nurses. I think everybody's probably well aware of these events and issues at hand. I'm not going to go through them, but the challenges are pretty much global, by the way, and the results are fairly self-evident. What I want to talk about is how to get you there and how we think technology plays into the information space. Look at some of the drivers, and this is done by DataQuest coming in here on 2 years, but it's still very relevant today of what the drivers are of IT in healthcare. So you've got reducing medical errors, automation, security, so forth and so on. Probably very relevant to the audience here today. These are things that kind of keep you awake at night, should we say, of where we're going and what kind of issues are at hand. So what we want to do is we want to help focus organizations on how to achieve this to the best of their satisfaction. Now, obviously, technology is something we replace. If I look at spending, and there's been an increase, I think the John Wade yesterday from the HIMSS organization spoke, 1 to 3% is kind of the average what people spend in IT. It's relatively low on a general basis, but it's growing. Not like rockets, but it is definitely growing, and that's important to increase the spending. Because the spending will help you achieve why the network. We get this question all the time, why the network? The analogy I give to people is you have a car, you can drive on a dirt road, you can drive on a highway. The car's performance will be affected by that road. Same thing here, you've got all these systems being laid on top of the system. Some are EMR applications, CPOE, PAC, so forth and so on. If the network is not designed to be robust and reliable and secure, then you have issues at hand. I came from the PACS market, and the idea I give people is not voicemail or email, you're having imagery. That is a tremendous burden on a network. So I want to make sure the network is common, it's scalable, and at the same time you keep up with the different technology. So it's the only common single element that does cross the whole ecosystem when you sit back and look at it. So it does become very relevant at the end of the day in terms of network capabilities. I think some people before me have spoken about this. We have been traditionally known as selling to IT, CTOs, CIOs, so forth and so on, but we were speaking to someone here earlier today. There are all these other business decision makers, and this is becoming paramount to get them all together. We focus historically on that technical decision making, folks that have to make it work, shall we say. But there's all these other drivers in a healthcare environment that really are the business stakeholders, workflow environments, patient care, patient safety, quality of care, CMOs, CNOs, so forth and so on. What we're trying to do is bridge that gap. We see a lot of discussions happening in the top of the bottom of this ladder, and the idea is to bring them together. Because people are spending millions of dollars on applications, but probably look at the infrastructure last. Or some people look at the infrastructure not deciding what applications are running. So I think you get the point here. We're trying to merge these entities. And it's very difficult because they don't necessarily have the same reporting structure, the same budgets, the same touch points, but you really do need to get those pieces together. So we're trying to foster those relationships. And I think the people who have done that have been very successful in terms of site surveys, 3 to 5 year strategic plans, business planning, so forth and so on. It brings a lot of entities to the table. So that's one takeaway I think is important to the decision-making processes. In terms of what do we want to talk about? Well, it's really about the applications, and there's a number here listed I think you're fairly familiar with, but it's not just about the box or the system or that software package. It's really how do they all fit together? Because So people bring a lot of different things together today in healthcare environments. Some are relevant more than others, but depending on what your charter may be. But the idea is, how do I do this without growing the IT staff? That's probably a big challenge. More applications being dumped in that arena, less IT staff, but great demands by your end users, right? It's a big challenge. So we think if you infuse some type of technology, incorporating the business roles of your stakeholders, you'll be able to do a much better job of delivering those applications in a real-time manner. That makes sense, then? So if we look at, how do we go across this? I think the business drivers are relevant really across the globe, North America, Asia Pacific, Europe. Patient safety, quality of care, patient satisfaction are pretty relevant. And then you look at how do we get you there? So you've got these drivers, and then we'll talk about what are some of the solutions, some of the network technologies that may play into that arena. I think you see a pretty varied offering. If you look at building industry solutions, really what we're trying to get to, from a Cisco perspective, we just don't want to sell you a box and say good luck. We're really trying to partner with best of breed. So there's some companies here listed on that far left-hand side. They're what I would call complementary technologies to us. Things like asset tracking, EMRs, nurse call integration, DICOM storage backup system. So there's a number of companies we work with, so best of breed brought to you as a solution. So it's not just, here's the wire, here's the box, go make it happen. We're trying to make sure we validate that architecture before, so we do some of that upfront heavy lifting with you as a customer. So if I look at specifically the medical grade network, should we say, this is really not a product. It's an architectural design where we would sit with you and understand what is your 3 to 5 year plan for dropping applications on top of that network. So if you're going to do a PACS implementation or an EMI implementation, whatever that case may be, I want to go back to one of the points I talked about earlier. Where does your network stand? Where does it need to be? Because what we don't want to do is just drop an application on there, and once again, the PACS environment. I spent a lot of time with radiologists going over every bell and whistle that the management involved in a PACS workstation. But we never talked about the infrastructure. So they buy the system because they saw a canned demo, great performance, images come up in a second or less, put it in, the response was so slow because they didn't look at the back-end system of what they needed to get those images from the facility. So we want to make sure the network is really designed to be responsive, interactive, and resilient, and obviously protection built into security. So that's what we're talking about, the medical grade architectural design. In terms of a graphical representation of that, what you have is you have the what we'll call core technologies at the bottom of this diagram, which are very relevant to most people in this room. And then we put the applications on top of that, we lay it on top of it. So you've got this core technology, you've got this enabling architectural design, the medical grade network, and then you drop the applications on top of it. And I'll talk about some of these applications in the next few minutes. Also, just to show you a graphic representation of the medical grade network. We talk about mobility, how this fits in. This mobility is used in a lot of different manners in a healthcare environment, any environment. We will talk about mobile care, location aware, and wireless in general, to kind of bring it all together. So if we look at, who are the users? Really, there's 3 buckets of users. This is kind of a generic approach, but we've got nurses, physicians, and administrators being the core users in a healthcare entity for mobility. And I won't read all this off. We're going to go through them in the next few minutes, but you've got a number of stakeholders with different work directions, should we say. Nurses are very mobile, obviously 70% of the time. They don't sit at the desk, for example. You get administration more standing, but they do interact with a lot of people throughout the entity. Then you've got physicians. They may be bouncing in a campus environment, site to site, office back to hospital. You want to connect all these people real time for the most part, right? So you've got a number of technologies that come into play. You've got the laptop, you've got the PCs, you've got the PDAs, and so forth and so on. The idea is how do you make these people productive so that it's seamless to them when they move from facility to facility, room to room, campus to campus. So if I look at what the characteristics are, well, they're pretty self-evident. You've got a highly mobile workforce these days. People job share, so forth and so on. So they've got to enter information into the system somehow and then extract that information. They've got to treat multiple patients. They need to do decision-making fast. They don't have a lot of time. Time is of the essence, right? They need to move from one patient to the next to the next. So they want to make sure they have minimal time to react, but then being very high-quality care being delivered. So we've got these characteristics in a healthcare environment.